are going to talk about heart health. Thank you for joining us today. My name is Dr. Jeff Gelband. Before we dig into some of the meat of it, I'm just going to tell you a little bit about Aligned Modern Health and me. All right. At Aligned Modern Health, we are an integrative medicine clinic. We aim to treat the different problems that ail you by getting to the root cause, not merely addressing symptoms. We have 4 major teams there. Our chiropractic and physical medicine team helps handle aches and pains and restore your ability to do the things you want to do. If you're having any difficulty with function, those kinds of issues. Our clinical massage therapy team helps with muscle soreness, headaches, those kinds of things. They work hand in hand with our chiropractic physical medicine team. Our acupuncture group manages stress, anxiety, depression. They do an incredible job, and they handle a lot of the same problems we manage on the functional medicine and clinical nutrition team, but just a different approach to care. And then finally, my team, the functional medicine clinical nutrition team, we handle gastrointestinal autoimmune disorders, food sensitivities, weight management, and cardiac issues like we're going to talk about today. Tell you a little bit about me. I'm Dr. Jeff Gelband. I'm a board-certified chiropractic internist. I'm the Associate Director of Functional Medicine at Aligned Modern Health. Some of the different issues that I focus on are nutrition, cardiovascular health, digestive health, and hormonal issues. I got my Doctor of Chiropractic from the National University of Health Sciences and my Bachelor of Science in Biology with a minor in chemistry at Northern Illinois University. I've served in the military for a little over 18 years. I'm now a second lieutenant. It's actually really exciting for me. I was recently a master sergeant. I got promoted. And I train and certify members on CPR, as well as another class I now teach called Tactical Casualty Combat Care, but not as relevant for this presentation. I think a lot of the people here understand why heart health is important, especially when we're younger. We may not take it as seriously, but as we get older, we start to see issues in our friends or family members. We may even be experiencing some heart issues ourselves in our 30s or 40s, hopefully not, but sometimes it happens. But just to give you a little bit more perspective on how big a scale, how big a problem this really is, from Johns Hopkins Medicine, 2,200 deaths per day occur due to cardiovascular disease, averaging 1 every 40 seconds. 78 million adults have high blood pressure and 20 million have diabetes. An additional 8 million have undiagnosed diabetes. And we're going to talk about the relevance of diabetes and how it affects cardiovascular health a little bit later. 87 million have prediabetes, and unfortunately, those numbers are only going up. Cardiovascular disease is the cause of more deaths than cancer, chronic lower respiratory disease, and accidents combined. It's a huge problem. And on average, someone suffers a stroke every 40 seconds every day. So this really is a problem. It's huge. It's all over the United States. It affects almost everybody. Before we get into more about how to actually manage cardiovascular disease, it's important that you understand what cardiovascular disease actually is. And you may have heard some of these terms, but not completely understood them. We'll go through them just briefly to give you a basic understanding of what's really going on. An arrhythmia is just an abnormal heart rhythm. They don't always cause a problem, but some of the more common ones like atrial fibrillation, you may have heard of that, or AFib, that can lead to stroke. It gives an increased risk of stroke. Atherosclerosis is that plaquing in the arteries that we talk about. It's one of the most common causes of heart attack and stroke, and it's also highly preventable. A heart attack itself is when blood flow to a part of the heart is blocked by a blood clot. If the clot cuts off blood flow completely, the part of the heart muscle that's supplied by the artery begins to die. And even if it's not blocked off completely, sometimes that plaquing we talk about just narrows it and reduces the amount of blood to get there. That can cause its own set of problems. Heart failure, the heart's still pumping. It sounds like it stops pumping, but it doesn't. But it's not able to pump blood effectively. And that can lead to a backup of blood in the system, causes a huge number of problems. Heart valve problems. Fundamentally, this description here talks about one of the issues, but what heart valves need to do to function properly is they need to open and allow blood to go through when the heart pumps, and close effectively, not allowing blood to go backward. If they don't do either one of those things correctly, it's a problem. It doesn't open enough, we call that stenosis. If it doesn't close properly and lets blood go backwards, we call that regurgitation. And then finally here, stroke occurs when a blood vessel that feeds the brain gets blocked, usually from a blood clot. Behind the scenes, the first thing I'm going to go over here is how the healing process in the blood vessels occurs in a normal individual without a problem. So endothelial damage occurs. Endothelial is kind of a fancy word for the inner lining of the blood vessel. When that damage occurs, just from us being alive, it doesn't have to be from anything crazy, the body forms a blood clot over the top of it. Over time, the blood clot gets minimized and a new layer of endothelium, that inner lining, grows over the top and incorporates that into the artery wall. I'll give you an analogy of sort of the same thing you might be more familiar with because it sounds more complicated than it actually is. Basically, if you got a cut on your skin, let's say you got a cut on the back of your hand, a scab grows over the top of it to stop it from bleeding. That's the same thing that's happening here. That's the blood clot they're talking about. After that, as that scab starts to heal, eventually skin grows over the top of it. Sometimes for the skin, the scab will fall off. We don't want that to happen in the blood vessel. That's bad. But the skin will grow over top of it, and then hopefully it's just like it was before, functions as it should. That's what happens in a normal person. That leads to inflammation. We're going to talk about inflammation in this, and inflammation kind of it's like the boogeyman. It sounds scary, and usually when we're discussing it, really we're discussing when there's too much inflammation, because anything that causes repair from damage causes inflammation. The problem with cardiovascular disease occurs when those repair systems are either overwhelmed or compromised. That's when we get these kinds of issues. Insulin resistance, type 2 diabetes, and other problems can cause that to happen. We're going to talk more about those. These are some of the strategies we use to evaluate risk, and there are a lot more, but these are some of the basic ones. To go back to what we were talking about the body's repair process, that's where LDL and HDL come in. You may have heard of these. LDL we call the bad cholesterol, HDL is the good cholesterol. I think it's unfair because LDL does not deserve the reputation it has. No, we call it bad. It's kind of silly, but it is bad when it gets elevated. And it's really what that elevation represents that's bad. But LDL itself has a very important function. And when we talked about that scab that kind of forms on the inside of the blood vessel, what LDL does is it helps to put some cholesterol over the top of that scab to protect it from the bloodstream. Because remember, your blood never stops pumping. Your heart is always pumping. And so when that repair process is happening, blood is flowing over that scab. And we think of the blood as a liquid, and it is a liquid, but we think of it as only a liquid. It has a lot of things dissolved in it. So that can cause a great deal of friction while that blood vessel is trying to repair itself. So LDL protects it. That's great. What ends up happening there is once the healing is done, HDL comes out, the good cholesterol, and it comes and cleans up that cholesterol and the blood vessel that LDL laid down. Here's where the problem happens. If your body has a whole lot of LDL and we see those numbers start to rise, it indicates to us that is going to overwhelm your body's repair system. So when we see that number, we know there's going to be plaquing because there's just too much vessel damage occurring for your body to repair appropriately. And when HDL cannot keep up with all of those cholesterol plaques that are getting laid down, we get dirty vessels. And eventually those plaques calcify and they cannot be removed by HDL. So that becomes a permanent change. That's the problem. Explaining insulin a little bit. Insulin is important for blood sugar control. We use insulin. It's very important. We need it in something like diabetes. We're going to see that kind of run out of control. And even before diabetes and pre-diabetes, people will develop insulin resistance. The problem here is that insulin is very inflammatory and causes vessel damage. So it can cause issues with LDL. Blood sugar causes its own set of issues. This is again how diabetes comes into play. Not only insulin, but sugar itself actually coats the blood vessels the more you have. That can cause a reduced ability to heal, and it can also cause a reduced ability for your body to actually get blood where it needs to go. This is why, unfortunately, later in some uncontrolled type 2 diabetes, they can have issues with their feet where they don't get enough blood flow and they can actually lose their toes or feet. It's a very sad situation. So it's very important to control that. High sensitivity C-reactive protein is a marker created by the vessels in response to inflammation. It's one of those things we use to measure it. Homocysteine is another marker. It relates to how well your B vitamins are doing their job and how well your body's eliminating certain kinds of waste that it makes. It can be, it's one of the markers we can use to identify risk. Iron, if you have too much or too little, can cause cardiovascular issues. And omega-3s we're actually going to talk about a little bit more later, but is very important for reducing risk. I mentioned early on that we try to look at the root cause, and we try to do that by looking at the whole person. We're very data-driven in how we approach problems. This is a study, you don't need to get close to your screen and read this, I'm going to talk about it, but this study relates to the gut microbiome and lipids. It came out a few years ago. It was 893 participants, so a little on the smaller side. They found that the absence of six specific species, which are very commonly present, predicted a higher BMI, meaning those people weighed more. They found that gut bacteria altered the good cholesterol, triglycerides, and weight, and these results were consistent even when considering the effect that age, sex, and genetics had on those individuals. So the point here is that these findings supported the potential of therapies altering the gut microbiome to control body mass, triglycerides, and HDL. There's more research going into this all the time, and even just the gut and the different bacteria that are growing there and the effects those have on the body, we are finding more out about this all the time. A quick note about statins. Some of you may have heard of statins. They're a very common medication used to control blood lipids or cholesterol. It's estimated that 1 in 5 Americans have been prescribed a statin. That's a lot. Statins are not always the wrong approach. We'll talk about that in a moment, but there is a lot of research showing that dietary changes, specifically a Mediterranean diet, is much more effective at reducing the risk of cardiovascular disease, even when taking into account the amount that it lowers cholesterol. So it didn't lower cholesterol as much as the statin did, but it had a greater effect on reducing the cardiovascular disease. There are some people who need to be on statins. Those with something called familial hypercholesterolemia. This is when that LDL elevation, that bad cholesterol being high, is not necessarily caused by the damage to the blood vessels. They simply have too much of it because of a genetic issue. That is a good example where many, if not most of those individuals should be on a statin as the first approach, because diet and lifestyle probably will not cause an appreciable change in their cholesterol. Some of the side effects of statins, one of the big ones is it reduces CoQ10. CoQ10 is a substance, your body makes it, and we do get a small amount of it from the diet, but it actually helps your heart maintain its energy levels. So reducing that is a very big deal. It does some other things, and it can increase the risk of cancer, diabetes, cataracts, a bunch of other things. All this to say, it doesn't mean statins are never needed, but it does mean that they're not a risk-free or harm-free treatment. Sometimes they're appropriate, and that's a conversation with your provider, but they're not always the best first-line approach. Speaking of first-line approaches, the effect of aspirin, don't worry about reading this either. A lot of us may have, we may remember those commercials from the 90s or early 2000s where, you know, I think it was a dad and a son, they're playing basketball, and oh my gosh, dad's heart starts to hurt, and the commercials advertising the benefits of taking aspirin every single day when you're over 50. Well, that's not what the science shows us. This was an interesting study. This actually came out a few years ago, and what they went to do was to evaluate, does aspirin prevent heart attacks in people who do not have any existing cardiovascular illness or significant risk factors? So they expected that it would. That was the goal of the study, was really to prove that. It was a very big study, 19,000 people over 14 years. They found that aspirin increased the risk of death by cancer. And you might think, well, oh, okay, maybe it did, but maybe it decreased the risk of heart disease more. It had no effect on the risk of death by heart disease. So that was a very unexpected result in this study. They did not think that would happen. It increased the risk of death by cancer and had no effect on the risk of death by heart disease. Now, there are some people who should take aspirin. I am not saying that no one should take it, and we're going to talk about that. The FDA and the American Heart Association do not recommend aspirin therapy for prevention, of people who have never had a heart attack, prevention of heart attacks and those who haven't. So this isn't just coming from me. Here's from the FDA. After carefully examining scientific data from major studies, FDA has concluded that the data do not support the use of aspirin as a preventative medication by people who have not had a heart attack, stroke, or cardiovascular problems, a use that is called primary prevention. In such people, the benefit has not been established, but risks such as dangerous bleeding into the brain or stomach are still present. From the American Heart Association, because the risk of bleeding, aspirin therapy is not recommended if you have never had a heart attack or stroke, except for certain carefully selected patients. If you're over 70, taking aspirin to prevent a heart attack or stroke could do more harm than good. Here's the point. Your doctor may prescribe for you to take aspirin for some reason. You may have some specific risk factors, or you may have had a heart attack before. If your doctor has prescribed it for you, they have evaluated the risks and you should take it. But you should not take it simply because, for example, you're over 50. That is a clever piece of marketing that you've heard from the people who make aspirin. There has been a lot of research on this, and it does not work to prevent heart attacks or stroke in people who have not had them. So very, very important. Now, all of what we've talked about is about heart disease, how to avoid some of these things. These are some of the things you can do. You may have heard some of these before, but we're going to go into a little more detail. Instead of going after the symptoms, which LDL is a symptom, it causes heart disease, but it's a symptom of a problem, of generally poor diet and lifestyle factors. We like to go after the issue. To do that, we want you to enjoy a low-carb, low-processed food diet and increase nutrient absorption, optimize your vitamin D and magnesium levels, normalize omega-3 and 6. We're going to go into all this stuff. Implement a healthy sleep routine, exercise regularly, and reduce stress. Now, all of this is easier said than done, but we'll talk about it. Hopefully, you're going to get some things you can do at home to do this. Diet and nutrition. We want to restore nutrient deficiencies. The only way to know if you have one is to test for it, but ensuring that you're eating foods that are very high in vitamin C, K2, and magnesium is very important. There aren't many foods that have a lot of vitamin D in them, but still very important. Ensuring you eat a lot of organic vegetables. These are the powerhouses. I think we get really caught up in certain health trends, and we try every couple months or a couple of years, there's a new superfood. I really like that term. And it's always like a berry. It's always something sweet that they can make into a candy. So you see candies always, like goji berries or whatever the new one is this week. But the truth is, the superfoods are the vegetables that you just don't want to eat. That's kale, broccoli, Brussels sprouts, spinach. Those are the real superfoods. Those are the things you need to eat. You will live longer, and we have mountains of research on all the different things these help prevent, especially heart disease. With that, there's also a belief going around that, well, if I have my salad with ranch, that's the same as having a burger. I've heard this from patients. That's not true. It may be the same number of calories, and that can have its own problems. Reducing calories for some people can be good to reduce their body mass index or other things, but I would rather you eat the salad. The thing they're neglecting in that kind of conversation is all of the micronutrients and benefits that you get from eating the salad. And that doesn't mean you need to eat salads every day, but it would be a great idea to incorporate more of those vegetables. And even a silly thing here, let's say you are going to have a burger, throw more vegetables on it. It's more about including these things than restricting other things. And they're, of course, to a point. With that said, eat the salad, eat those green leafy vegetables. If it takes ranch for you to get them down, I'm all for it. We want to make sure we have healthy fats. Making sure we incorporate those healthy fats in our diet is good for our vessel health, but also keeps our blood sugar nice and stable. This is a list of some of the more common ones for like when you're cooking: coconut oil, MCT oil, extra virgin olive oil. But some of the other ones you get through eating are going to be nuts and seeds, avocados. They are phenomenal. So Don't neglect, they don't have to be obtained just through cooking. You can get them through the food choices, even fish, which we're going to talk more about. Hydrating, so important, at least half your body weight in ounces. However, if you're only drinking, 20 or 30 ounces of water a day, don't just jump right to 100 ounces. You're going to be in the bathroom nonstop. I mean, if 100 ounces is the appropriate amount for you, slowly ease yourself up over time. Okay. And that's going to make it more palatable and you're going to feel better. A lot of people even notice their energy improves when they start drinking more water. Down here, you see avoid skipping meals and avoid processed foods. In fact, I didn't have time to put it in here. There was a study that came out in mid-January about intermittent fasting and that it can increase cardiovascular risk. I know it's really popular right now, and for a small number of people, it can have some benefits, but there are risks associated with it, and increased cardiovascular risk is one of those things. Vitamin D and magnesium. These are important for a huge number of processes in the body. Vitamin D, so much so that there was a period of time where there was some discussion about reclassifying it as a hormone because it affects so many things. Reduces inflammation, helps regulate glucose metabolism. It's important for bone health and calcium levels in the blood. So important. Getting regular sensible sun exposure is one of the best ways to get it, but in the Chicagoland area, you might need a supplement. It's not always easy to get here, especially today. It's a little overcast for those of you that are in the Chicagoland area. Magnesium, important, used by the heart, blood vessels, and muscles to actually relax. So it can help with blood pressure. I was about to say blood sugar. Blood pressure in those who are having issues there. Does a huge number of things. It's involved in almost all tissue in the body in some way or form. Some of the best sources of it: almonds, cashews, avocado, black beans. Edamame and soy milk are okay for some people. They can cause hormonal issues for others. And then spinach and yogurts. Those are some excellent sources of magnesium. Omega-3s and omega-6s, I said we talk more about this. You may have heard of these. It's very trendy to take them, and I'm pretty happy about that, actually. It's great. Getting them from a supplement is okay. Getting them from food is better. And that actually goes for any nutrient we're talking about. Almost all of these nutrients are better when obtained through food. They're better absorbed. They're better forms. Sometimes we need a supplement, but if we can do it through food, even better. Omega-3s, you can see the list there. They do a lot of things. One of the biggest things they do is they are anti-inflammatory. They improve the endothelial function. I told you that's that blood vessel lining. It actually functions better in the presence of omega-3s, and they do a huge number of other things. The best sources of these are going to be fatty fish. There are some vegetable sources. They don't tend to work as well, but if that's what it takes for you to get them down, go for it. It's better than nothing. Generally speaking, if you're not eating a reasonable amount of good, healthy, fatty fish 1 to 2 times per week, you probably don't have enough. If you just really hate fish, okay, so be it. It's better if you can eat it, but in that case, hey, a supplement might be the more appropriate option for you. At least we're going to get them in. I have them listed there. Salmon, sardines, and anchovy are some of the better ones. Sardines and anchovies, I get a little bit of a fight about, but there are plenty of other good ones. Cod, mackerel, there are so many. Not everything is good though. Catfish, for example, tends to be much higher in omega-6s than other fish. So, and tilapia as well. Those are some of the more popular fish. However, they're better than having, for example, a burger. So if that's the kind of fish you like, it's still better, but they do have much more omega-6s and less omega-3s than the other kinds. And omega-6s, I didn't say, those are those inflammatory fatty acids. Omega-3 are the anti-inflammatory. So those are the better ones. Implement a healthy sleep routine. Sleep is so important. It's important for everything. If you're not sleeping right, even if we ignore the different cognitive effects, that is the different effects it has on your brain, your body uses sleep to repair. You're not properly repairing your blood vessels and a lot of things if you're not sleeping properly. Ideally, 8 hours of sleep is what we aim for. If you can do 7, great. Some people don't need as much, but the majority of people need 7 to 8 hours of restorative, effective sleep per night. Some of the strategies to sleep a little bit better: turn off your electronics and bright light at least 30 minutes before bed. Keep your bedroom dark and cool. And cool means about 2 degrees lower than a comfortable temperature in your house. Usually that's comfortable for people who are sleeping under their blankets. Turn off Wi-Fi, put your work away. Try not to do work in bed if you can. You want to make sure that your body knows that bed is a place for sleep. That goes into developing a bedtime routine. We want to make sure that you do approximately the same thing in approximately the same order every night. This primes your body that after this routine, it's time for sleep. Avoid a lot of fluids and urinate prior to going to bed. Avoid caffeine late in the day. Generally, the advice given is avoid any caffeine after noon. Some people don't have much of an effect or aren't affected by that. Quite a few people are. Utilize breathing exercises. If you're having a difficult time sleeping, one of the most effective things you can do is trying to use breathing exercises when you sleep. We're going to talk a little more about this with relieving stress later too. But one of the most effective things is called box breathing. That is breathing in for 3 seconds, hold it for 3 seconds, out for 3 seconds, and hold it out for 3 seconds. Repeat that 2 or 3 times. There's some pretty good research showing it helps people reduce their stress, relax, and sleep. Exercise regularly. This will help with sleep also. However, it has a host of other things it does, including increasing good cholesterol, making sure you have an appropriate body mass index, and keeping your blood flowing in a healthy way. One of the best things you can start with, if you're not doing much now, increase the steps you're getting. 10,000 is a good number to go for, but if you're doing 2,000 now, maybe go for 5,000. See if you can do that. Then 7,000, then 10,000 a day if you can. There are some good strategies for that listed there: parking further away, taking the stairs, all sorts of things. But hey, if it comes to it and at the end of the day, it's just, boy, I didn't hit my number, just start walking around. As the weather improves, that gets easier and easier. With that, it's about progress, not perfection. Do what you can. Strength training is important. We've actually found some research that it's very important for decreasing the risk of diabetes. And then stretching and yoga are so important for reducing stress, in addition to staying fit. On that note, stress is so important. This is your body's fight or flight response. When you sense danger, whether or not it's real, your body has the same response to it. It releases that stress hormone cortisol that you might have heard of, and we're almost finished, by the way. But we want to make sure we control this. Having this on occasion is not a problem. Your body can handle that most of the time. The problem occurs when it's constant. Your body doesn't have an opportunity to relax, to heal. Listed below are some of the things that you can do. I said deep breathing, that same box breathing I talked about, meditation or mindfulness, limiting or eliminating alcohol and caffeine, exercising and incorporating yoga, so valuable. Keeping a journal and acupuncture is huge, monumentally important, and you can do it in addition to any of those other things. It is so good. Highly recommend it. In summary, cardiovascular disease is everywhere. We talked about that. Often the first approach is pharmaceuticals, and sometimes that's the right approach, but more often, diet and nutrition, healthy sleep, exercise, reducing stress will be even more effective. And outside of just reducing your cardiovascular disease and helping you live longer, it'll make you want to live longer. It'll improve your quality of life. We can regain control of our health and stop heart disease before it starts. All right. Thank you so much for joining us today. We'll answer a few questions in just a moment. Please enter any questions you do have in the Q&A feature. If you have something a little bit more personal you'd like to ask, or want to have a better understanding of how what we talked about could be applied to you or your risk, please schedule a free 15-minute consult by calling 312-692-6700 or visiting us at alignedmodernhealth.com. Listed below there are also some of the different insurance providers that we're in network with for our various practice lines. Let me open up the Q&A here. All right. What is the difference between refined coconut oil and unrefined? Which one is best? Great question. Depends a little bit about what you're doing with it. Unrefined tends to be better. One of the things there, when it's refined, it'll have a higher temperature you can cook with, but unrefined has some additional sub-fractions, which are a little better for heart health. Same thing's true with olive oil. Refined olive oil, even though it's not as good for heart health, is a little bit more effective for cooking because it has a higher smoke point. I'm not going to get in the weeds on that. That's a whole other topic. All right. Warning signs for women. That's a great question. So there are some warning signs that are more common in women that aren't as often in men. So in men, a lot of us know that kind of left shoulder pain and the chest pain is there. Women certainly can have that. Women will sometimes even have right shoulder pain associated with it or have pain in their neck or jaw. That's a little bit more common for women, and that can be a good sign. That's an excellent question. Thank you for that. Is ibuprofen bad for your heart? For example, not taking it all the time, but temporarily for inflammation, for example, after surgery for a number of weeks. No, not necessarily. There are times when that can be appropriate. That's a little bit more of a case-by-case basis, but it is not inherently bad for your heart. Absolutely not. Intermittent fasting can increase heart risk. Is that just in extreme cases, or excuse me, specific cases or in extreme fasts over 24 hours? The study, I believe, did a 16-hour fast. I would have to double check, but they did a 16-8, I believe, for that particular study, and that was what they found. They did evaluate for other longer fasts, and more fasting did lead to increased risk. Is there a specific type of vitamin K2 that is best? I've heard MK7. MK7 is the one we have the most research on. That is best to help balance levels of calcium, absolutely. But all of them are good, and you get the full spectrum of them through food. But in a supplement, generally, you'll see a subtype 7 as the most common one. Is popcorn inflammatory? Yes, corn is very inflammatory. And popcorn isn't worse than corn, it's just corn. Also, what do we do with popcorn? We put butter and salt on it, or kettle corn. Let's add sugar to it too. So yeah, popcorn is generally not very good. But again, everything in moderation. It doesn't mean you can never have popcorn, but it should not be a staple of your diet. I'm always worried about high saturated content of coconut oil. How do you reconcile that concern with individuals who have heart disease risk? Excellent question. Not all saturated fat is the same. Coconut oil has a higher concentration of certain kinds of fats called medium chain triglycerides and other things, where we have found that it does decrease the risk of heart disease. However, like everything else, you still want to make sure you're having other balanced mono and polyunsaturated fats that are healthy too. Monounsaturated are usually from olive oil. That's one of the most common sources, but there are some others. Polyunsaturated are those healthy omega-3s. Some vegetables have them, but often when they're in vegetables, they are omega-6s, which can be unhealthy. That's where vegetable oil isn't great. I'm not going to go into too much on that. That's a little bit more. I see a couple of questions that are a little bit more personal. For those, I'd recommend scheduling a consultation. That'd be a little bit better. And let me see, we'll go through maybe one more. There are differences between omega-3s being on a plant-based diet. I've heard that flax and chia do not give the same omegas that fish would. That's true. Flax and chia seeds are higher in a type of omega-3 called ALA. A little bit different. The ones we find in fish are EPA and DHA, which come from animals. We're animals too. And so those are the ones that our body utilizes more. It does use ALA, but it uses it in a less effective way than EPA and DHA, which are found in our brain in large concentrations, blood vessels, so on. A vegetarian or vegan diet can be very healthy, but it has to be done very strategically to do so. Okay, again, I see a few more. So that's all the questions I'm going to have time for today. I do have patients I need to see, but I hope that this was helpful for all of you, and I really want to thank you all for coming. Again, please don't hesitate to call or go to our website for a free 15-minute consultation, and I look forward to seeing you in our offices. Have a great rest of your day.